Vaccinations are important for many different reasons. They prevent horrible diseases, they keep communities healthy, they're responsible for eradicating diseases like measles and polio in many countries. However, despite these benefits, more and more people are opting out of vaccinating their children. Today we are going to explore the problems related to not vaccinating, then we're going to take a shot at understanding the underlying causes, and finally, we're going to explore what we can do to inoculate ourselves from misinformation. First, let's look at some of the problems with not vaccinating. When you don't vaccinate your children, they are much more likely to get diseases like polio, measles, and mumps. Despite the diseases being relatively uncommon now, the risk persists because the germs and viruses are still alive in our environment. Herd immunity is important because it protects people who are unable to get vaccinated, people such as cancer patients, transplant patients, or even children who are too young to get the vaccinations. Now that we've explored some of the problems with not vaccinating your children, let's look at some of the underlying causes. Anti-vaccination propaganda is one of the main concerns that we have today. In 2016, a scientific study was done, and it found that on Pinterest, 75% of posts related to vaccines were negative. Pinterest has since taken considerable action to minimize anti-vaccination content on their site, but that's still a concerning number. It reflects the general public's attitude towards the vaccination community. The next underlying causes are money and time. According to an article on Forbes, money and time are significant factors when vaccinating children. Because there are so many shots to administer, it takes several doctor visits to keep up with the government schedule. So we're not only thinking about the time it takes to visit the doctor, but also the copay that you're paying each and every time that you visit the doctor. On top of that, for many healthcare professionals, the reimbursement that they get from Medi-Cal, Medicare, other social programs are so low that they don't even offer vaccinations at their clinic because they're not making any money off of administering vaccines. Now that we've covered our problems and causes, let's look at some tangible solutions. First, we need to increase the availability of accurate information regarding vaccines. Now, I know scientific journals are definitely important and we have wide access to them on the internet, but for me or people who are not educated in the healthcare field, those journals are very intimidating to read. We need a lot more information that's easily understandable and easily digestible for the average person to consume. There's a plethora of information available to us regarding why vaccinations are not necessarily maybe good. And of course, these aren't journals that are written by scientific professionals. They're journals or they're articles written by people who, maybe saw something firsthand, or they have anecdotal evidence and want to spread misinformation. Now, I think it's important that we expand our access to scientifically accurate information that is easily digestible, because we need to know the truth. We need to make the truth understandable for people who are scared, who have been reading these articles and are terrified of the consequences, of what the consequences might be for vaccinating their children. Not only do we need to make that information more widely accessible, but we also need to start looking at the administration of the vaccines. Now, as I cited previously in my underlying causes, time and money is a huge factor when considering the vaccination schedule that is government mandated. You have people lining up to go to the doctor's office, people who have to pay multiple copays on top of copays in order to keep their children vaccinated and healthy. Now, something that we could easily do is combine some of the vaccinations into one shot. We don't need to be giving individual vaccinations every time someone goes in for a vaccination. Now, I understand that, maybe not all vaccinations can go in the same shot and be administered at the same time. And of course, I respect that. but there is no doubt some that could be condensed and administered in one shot, thereby making it a more streamlined process, a less expensive process, and a less expensive process for both the doctor and the patient. So today, we've explored problems with not vaccinating, why that problem persists, and what we can do to combat this epidemic. Let's stay informed and stay healthy.